It is now my privilege to introduce my friend and colleague, Dr. Walter Greenleaf. Walter is a neuroscientist and medical technology developer at Stanford University with over 3 decades of research and development experience. Walter is a leading authority in the field of digital medicine, digital therapeutics, and virtual reality. And we are privileged to have him here today to speak to us about his knowledge and experience on virtual reality and how it's transforming healthcare. Walter, welcome, and thank you for being with us today.
Well, thank you so much, Rob. I feel excited to be here, but I also feel very relaxed now. And thank you, Anusha, for that. I suppose this is the part of a presentation where I would normally try and get familiar with the crowd and maybe make a few self-deprecating jokes, but unfortunately, I can't see anyone right now or hear anyone, so I'll have to defer on those. But I am very excited to be here. I've been very pleased to see the great progress that Hoag has done moving forward this very important part of medicine. Next slide, please. So what I will try and do today is, in the time that I have, is to cover a bit of an overview. I want to lay the foundation for the rest of the presentations. I will talk about the context of the digital health revolution that medicine is going through right now. I will talk about several of the emerging and confluent technologies that are supporting that revolution. I'll talk briefly to try and give us a general overview of what's coming down the road in terms of next generation technologies for VR and AR, what we sometimes call XR technologies. Because I'm a neuroscientist and because it's important to understand the power of VR and AR technologies, I'll also talk a little bit about the way VR and AR technologies are able to influence our perceptions, our brain processing, and how we can leverage the neuroplasticity, the ability of the brain to learn, to improve medical care, in particular in behavioral medicine, psychology, psychiatry. I'll talk a little bit about the history of virtual reality because it does provide a foundation for where we are in a context. I'll try and give a bit of an overview of where the action is right now, what's really exciting, and to lay the groundwork for the speakers that will follow. And I'll try and do something that's always a little bit risky. I'll try and do a few speculations about what the issue will bring us. So next slide, please. So I have the honor of having several academic affiliations. My center of gravity right now is at the Stanford University Virtual Human Interaction Lab, where we study how VR and AR technology can be used to influence attitudes and behavior, and how interacting with virtual simulated environments allows us to connect with each other and with the world and understand each other better. I also have the privilege of working with the Stanford Virtual Reality Immersive Technology Clinic in the Department of Psychiatry. And also one of my favorite groups to work with is the National Mental Health Innovation Center at the University of Colorado. That's my current academic context. Next slide, please. But I'm also very passionate about the looming healthcare crisis of an aging population. Of course, right now we're dealing with a frustrating and agonizing pandemic. But if we look further down the road, and not too far down the road, there's another crisis looming. Fortunately, we have some time to address it. Next slide, please. If we just look at the numbers, it's not a matter of theory, it's just a matter of math. Family sizes have gotten smaller over the last 20 to 30 years, and the proportion of informal caregivers, family members, has grown smaller. Since the 1960s, the US population has doubled, but family sizes have gotten smaller. So if we look forward to the next decade, we see that there will be, we're going to be top heavy, that we're going to have so many seniors living longer with chronic healthcare conditions into their 70s, 80s, and 90s. And this will become a very challenging weight upon our economy and our healthcare system if we don't act now. Fortunately, we do have time to act now. Next slide, please. In my opinion, since we can't grow caregivers fast enough, and we have this problem, the only answer is to leverage technology. We need to transform healthcare with technology. Next slide, please. And that is why, in addition to my work with academic groups, I also spend time with a number of early stage medical product development companies, a few mid-stage and later stage companies, a number of players in the healthcare ecosystem. What I strive to do, especially when it comes to virtual reality and augmented reality technology, is connect groups so that the very amazing academic groups that are pioneer new interventions, hospitals like Hoag and the pioneers there are connected with the rest of the healthcare ecosystem so that we can together move things forward. We must work together as a community in order to move advanced technology forward and find the right way, the appropriate way to use it in healthcare. Next slide, please. It's important to have a community. So fortunately, there is a revolution going on, the digital health revolution, where we're leveraging mobile technology, machine learning, wearable sensors, and we're making the patient more of the center of attention. The place of care is not always now the hospital. As a matter of fact, as much as we can, we try and have the patient be the center of care. And that allows us to do some very powerful things away from the hospital, away from the clinics. Next slide, please. So really, it's all aspects of medical care that are being profoundly affected by the digital revolution, starting with health and wellness, moving more to objective assessments where we have better data to understand someone's cognitive function or emotional status or their physical function or their biochemistry. We're getting much better at training our clinicians and healthcare staff through more functional training using virtual environments to do more robust simulations. We're coming up with a whole generation of improved clinical interventions, and we'll hear about many of them in the course of today's conference. We have new ways to facilitate adherence, and that's very important. Healthcare is not easy. It's not easy to be a patient. It's not easy to address some very challenging healthcare problems, especially chronic healthcare conditions. And we're developing new ways to help promote people to adhere to what they need to do, both on a wellness viewpoint, but also in a therapeutic viewpoint. And of course, leveraging digital health technology allows us to reach underserved populations, areas that were very difficult to reach before, and provide distributed care delivery. So the full stack of healthcare is being profoundly affected by this digital healthcare revolution. In the last 10 years, every medical device has moved from a heretofore analog handwritten world where the data was not easily captured, now to a digital way, a networked way, so that we can capture, be it a thermometer, a sphygmometer, a goniometer. We can capture the data and put it into an analytical system. This is very important. Next slide, please. We also are entering the era of medical wearables, sensors that can be worn on the surface of the skin or implanted in the body that collect a large amount of information about our healthcare status in a very objective way. Next slide, please. It's really quite amazing what's going on, the revolution in wearables and hearables, things that we can wear while we sleep, that we can wear while we're listening to our music, that collect data about our healthcare status. Next slide, please. And it's not just the physical aspects of our health status, the chemical aspects of our health status. We also have new ways of looking at passive data collected from our smartphones, for example, or voice analytics as a biomarker of anxiety or depression or pain, or facial expressions, or the way we move as we go about a task. All these methods of collecting information can now allow us to do a much better job of objectively assessing someone's mood, someone's emotional state, someone's healthcare status. Next slide, please. Moving us more from a speculative and subjective way of assessing things into a more objective way. And the importance of that is we're also now in a position to start aggregating data in a way that protects patient confidentiality, but it gives us the power of doing machine learning analytics to do predictive medicine, prescriptive medication. On one side of this very powerful system, we have patient-facing applications. We have ways to do reminders and badges and nudges and engaging activities, information transfer through computers, through mobile phones, through tablets, through VR and AR systems, through the wearables that we have that are interactive. At the other end, we have ways for healthcare administrators, hospital administrators, counties, cities, and states to look at this information, understand trends and what works, what doesn't work. We also have a way for the scientists to decompose the data, look at trends, figure out the best treatment pathways for a particular individual, and evolve more of a precision medicine program. Next slide, please. So we're entering into an era of prescription digital therapeutics where there's a combination therapy where we might combine a medication with a computer-based app or mobile-based app to come up with a combination therapy where it's not just the biochemistry that we're changing through the medication, but also cognitive behavioral therapy provided hand in hand through a mobile app with the medication. Just as one example of how combination therapy is evolving as part of the digital health revolution. Next slide, please. So let me briefly talk about some of the other powerful emerging confluent technologies that are going to propel this new era of digital health and medicine. And VR and AR is one of the major pillars of this. Next slide, please. As you know, 5G is just around the corner. We're already seeing it implemented at a few places in edge computing. This will allow us to have much lighter weight display systems instead of the currently generation of more heavy HMDs. It will allow us to also do much more realistic rendering of graphic information, high resolution, and also much more complex decision making on the spot using machine learning. This connectivity that's provided by 5G and edge computing will make a big difference with cloud rendered virtual environments and real-time feedback of complex decisions and analytics. Next slide, please. Machine learning is allowing us to look at complex data sets and tease apart the critical paths, to understand trends and patterns that we otherwise were not able to find and identify. Next slide, please. We're also leveraging a paradigm that originally was developed for managing very complex pieces of machinery and factory systems. And that's the digital twin paradigm, where we model a simulation of a complex system. In this case, we're starting as part of the EMR to model us, to come up with a model that represents all the information that we can collect through electronic medical record, our genetic information, our behavioral information, all the historical information, and put that into a model of an individual and allow us to do some what ifs. Like, what if we what if that individual exercises more, loses some weight? What are the consequences for their biochemistry and for their behavior? And how does that have a ripple effect? So we're starting to move into the digital twin paradigm for precision healthcare for individuals. Next slide, please. Also, the sensor revolution is empowering us to do so many things. We're now at the point where we've moved into several generations of sensors, and we're now in the position where we have a strong ability to collect data, not just from ourselves about our behavior and our health status, but how we interact with the environment. Next slide, please. We're also getting into a position to start evolving some wearable labs where we can measure from the surface of the skin and sweat things like proteins and hormones and ions, be able to do a precision test non-invasively. Next slide, please. The current pandemic has propelled forward clinical lab testing at the point of where the individual is. So instead of a centralized lab, we will soon see technologies to do very sophisticated assays in the home to measure for respiratory diseases like COVID or flu A, flu B, measure for urinary tract infections, biomarkers of chronic stress and inflammatory disease. This will allow us to have a home health hub that collects information about our health status dynamically in a very powerful way. Next slide, please. Also, our culture is shifting. We're now getting used to the idea of being connected, sharing our information with each other, ideally in a very protected way that allows us to keep control of this information. But our culture is shifting too. Next slide. In terms of the field of augmented reality and virtual reality, we're starting to get much better with virtual humans, artificial beings that we can interact in the virtual world that are sensitive to us. They can sense our facial expressions, our body language, our voice tone, adapt their behavior to us. So one example, of course, might be a smart car that is sensitive to our mood state and adjusts itself dynamically. But also, as we build more virtual environments, the characters that are in there can be very behaviorally sophisticated. Next slide, please. Also, I think we're getting on the underside of what was called the uncanny valley. We're now starting to see AI-driven avatars that look like, sound like, have facial expressions that are similar to what we would do. This allows us to do some sophisticated things. For example, to have a clinician be available through post-discharge patients as represented by an AI system and the clinician's avatar. Much better than having a stack of Xerox paper sent home with the patient. To be able to log in with a mobile phone and ask a representative that looks like your clinician questions and get basic questions answered. Next slide, please. And of course, it's really important that we evolve the proper ways, and there's a variety of them, to protect our patient confidentiality of information. Next slide. So let me jump into the field of AR and VR technology and give you a sense of the overall landscape of what's happening. I won't have time to go into great detail, but hopefully give you a feeling. Next slide, please. In many ways, what's going on now reminds me of the early 90s when the personal computer was first coming out, and we were talking about the personal computer revolution, the information revolution, the internet revolution. AR VR technology will be the next computer revolution. It will be the platform that we use to work, to play, to socialize, to shop, to entertain, to communicate. We already see this transformation happening. Now, it's going to take a decade or so to really permeate and get out there as the common way that we interact. But for important areas like healthcare, we already can do some very profound things with today's technology. And as you'll hear today, from some of our other speakers, we're already making a big difference, able to accomplish things that otherwise we could not do. But meanwhile, this is a technology that is gradually going to be coming out into our lives and be part of how we interact. Now, frankly, I feel it's going to be a much more robust way to interact with other people and to work, to socialize and to work than texting or typing. So I'm looking forward to this evolution. Next slide, please. This really is a point of departure for the technology. Every major technology company has invested billions of dollars into this technology, and there's more that are jumping in right now. Facebook through Oculus, Hewlett Packard, Sony, HTC, Microsoft, so many of the tech titans are putting a major emphasis on this new evolving technology and interaction platform. It will soon become part of the enterprise. Next slide, please. So let me briefly mention why. Why is this technology so profound and why is it so exciting? Well, we have some unique capabilities that we cannot do otherwise. We can slow down time, we can expand time, we can go down a very focused level, we can expand back and look at complex processes in a modeling way. We can use an intuitive way of interacting with information. Instead of looking at a spreadsheet, we can visualize it in 3 dimensions and interact with it. It's highly functional. We can interact with people and concepts in an abstract or in a finite way in ways that we otherwise could not do. We can go places and, like an oil rig, and teach a training program on how of safety in a simulation in a way that otherwise would be too expensive and impossible to do. And again, we can slow things down, decompose things. A good example is just how we do things with flight simulators. We can practice for unexpected events and be prepared for something that might very, very rarely happen, but we need to be prepared for. And we can use the power of virtual reality technologies to help us learn complex processes in a user-oriented, personal way. Because we can facilitate better engagement by involving all the senses and the body, we're able to facilitate retention of lessons learned. Next slide, please. So let me give a little bit of nomenclature to set the stage for my colleagues who will be speaking next. When we use the term virtual reality, we talk about fully immersive virtual environments. There's a spectrum of immersion, and typically VR refers to fully immersive environments where we have a display in front of the face and 3D audio and motion in 3 dimensions through the virtual world. It's a fully immersive virtual environment. Next slide, please. We also have the term augmented reality is evolving. And in this case, it refers to when we overlay the real world with extra information. This provides, and many people are using this currently. You'll see it with cell phones and navigation, where people will pull up a map and see how to go and where things are located in a real-time 3D way. Next slide, please. And then the term mixed reality is emerging too. And in this case, it typically refers to the spectrum between augmented reality and virtual reality, where we have digital objects overlaid upon the real world, but we are able to interact with them either as individuals or as a group. Next slide, please. And sometimes we don't have to wear anything. We can step into a room that has a 3D projection that we can interact either as an individual or as a group. Next slide, please. Now, people have talked about the fact that VR has been slow to take off, and it's true. We've had laboratory-based VR technology for decades, and I'll talk a little bit about some of the research that's been done over that point in time. But when we look at consumer technology and compare the evolution of VR and AR technology, it actually is taking off a steep curve than other new technologies. We're adopting VR and AR technology at a faster rate than the color TV, video cassette recorder, the personal computer, or even the cell phone. The slope of engagement of this new technology is just actually quite rapid. Next slide, please. If we look at the number of connected VR headsets on one of the platforms named Steam, we can see that the growth is starting to approach the growth of utilization. There were more than 1 million, no, it's 2.75 million monthly connected headsets are projected by the end of this year. A phenomenal growth of utilization of VR systems. Next slide, please. The analysts tell us that within 3 years, VR will be adopted by 30 million users, and in 6 years, they're projecting 70 million users. So it's a technology that is emerging very fast. And fortunately, we're able to rally and with groups like Hoag Medical Center, explore its applications in clinical care. Next slide, please. Okay, so I've given you a bit of an overview of some of the trends and forces in motion. Now I'd like to get very specific about medical applications of VR and AR technology, again, to try and set the stage for my colleagues who will be speaking next. Next slide, please. XR technologies, immersive technologies are in the process of disrupting a number of industries. I think healthcare will be one of the first to really embrace XR technologies because it provides unique capabilities to the medical healthcare ecosystem. And I'll give some examples. Next slide, please. It's again the full stack of healthcare that's being affected, starting at prevention and wellness, moving to assessments, training, interventions, ways to facilitate adherence, and ways to reach underserved populations. All aspects of healthcare are being impacted by VR and AR technology. Next slide, please. At last glance, I was able to identify more than 200, actually by now it's probably more than 300 emerging medical AR and VR companies. And what's interesting is it's no longer just the early stage startups, that there's a number of public medical device companies and large pharmaceutical companies who are starting to make significant investments in this arena and bringing out new products. And we'll hear a little bit about that later today. Next slide, please. Significant investments are coming from major groups. Hoag has been a leader CSI has been a leader in this area. We'll hear from Dr. Brendan Spiegel next about his efforts at Cedars-Sinai. I've been really excited to see the investments and good work done by United Health Group in this arena. I'm excited by the technology that Hewlett-Packard is developing that I believe will have profound potential for medical VR and AR. And Penumbra, a mid-cap public medical device company, has just released some very exciting products for stroke rehabilitation. And I know that they have other products that they're contemplating that will also be major contributions. So the point here is that it's no longer just the academic groups and the early stage companies, seed and Series A stage, but that some of the larger groups are jumping in and helping us move this arena forward. Next slide, please. And it's not insignificant problems that we're taking on. Medical AR and VR can address several key healthcare problems in a very profound way with new ways of intervention. And these have been heretofore very expensive, very difficult problems to make progress on. We finally have some new tools. Next slide, please. There's a number of very important conferences and industry organizations. We'll hear later today from Bob Fine from IVRA, the International Virtual Reality Healthcare Association. We'll also hear from Dr. Brendan Spiegel and Brendan Brickhead from Cedars-Sinai to talk about the Virtual Medicine Conference. And recently, the FDA has put a lot of effort out towards bringing in the public to talk about how what they phrase medical extended reality can be put through a regulatory pathway. Next slide, please. Let me talk a little bit about the neuroscience of how VR promotes behavior change. Because VR systems are able to trigger our reward pathways in the brain to bring novelty and creativity and be able to reflect back progress that a patient is making on a difficult project, to slow down the speed of time, to cognitively engage an individual, we're able to activate the neuroplastic changes that can only be activated by activating the brain's reward systems. We can shorten the feedback loop and show people progress as they work to improve their function, work to exercise and or lose weight or to change their behavior. By closing the feedback loop, we reward people and show them the progress and give them the motivation to move forward. We can also leverage mirror neuron systems to help us understand ourselves and to have empathy for other people. And that's very important. Next slide. We'll hear later today from Aaron Guy and his work in behavior, but one of the principles that they use in their work I'm very excited about is how they use VR as part of imaginal exposure therapy. VR, because it can take you someplace else, and we'll hear a little bit more about this from some of the other speakers, because it can grab your attention and place you in another environment, is able to do exposure therapy in a very profound, controllable way. As opposed to in vivo or imaginative exposure therapy, we're able to control the degree of realism and staircase people up as they go through a therapeutic process. So for addressing post-traumatic stress, for addressing phobias and anxiety disorders, for addressing addictions and helping people learn to manage their cravings, we have new tools, new techniques to be able to address these very difficult problems. Next slide, please. And because we can create an avatar, a representative of one's future self, and link it into our health status and to our behavior, we're able to give people a vision and have a dialogue with an avatar representing your future self as to how the choices you make, the behaviors you have, the medications that you adhere to can promote health in the future. Closing this loop can be very profound in terms of helping people understand why they need to go down that difficult healthcare process and what the value is to adhere to some of the difficult things we need to do. Next slide, please. VR and AR systems have several tools in their tool belt to impact healthcare. We can create active involvement as opposed to passive involvement. The immersive experiences maximize cognitive engagement. We have very engaging and motivating environments. We can do team training. So it's just not an individual learning a process or working on their own. We can bring together people either in an anonymous or semi-anonymous way to work together in a virtual environment to do their rehabilitation or to post-discharge understanding of their clinical problem. It's also cost effective. VR platforms are a very effective platform. We'll hear a little bit more about that later today for telemedicine. Next slide, please. And one of the things I'm very excited about is the fact that VR and AR systems allow us to build stories around the healthcare journey for the individual. My colleague, Jeremy Bailenson, has published a book, which is certainly worth finding and reading, called VR Experience on Demand. But I also feel that VR and AR can allow us to have story on demand. We can create a narrative background to the healthcare journey an individual has, the rehabilitation process that they go through. And this can be very profound and very meaningful. It promotes superior retention, improved understanding, creates empathy, and promotes active engagement in our healthcare process. So it's a very powerful tool. Next slide, please. I'll talk very briefly because I think it's important context to have about the evolution of VR technology. The first general purpose VR system was developed back in 1987. It was very expensive and very uncomfortable to wear, but we were able to use VR technology. And this is about the time that I got involved in the VR field. Next slide. The headsets were so uncomfortable and so unwieldy. The computers were the size of a small refrigerator and cost $500,000. But we were able to do research and start understanding the applications of the technology to healthcare. Next slide. Along the way, I've had dozens of hardworking colleagues who have focused their career understanding the clinical applications of VR and AR technology. One of them, Hunter Hoffman, will be speaking with us later today about his work on specific to VR and pain. The point of this is that VR is not just a technology that has evolved from the clamshell 5 or 6 years ago. It's something that we've had in our university research centers for decades. And we've been able to understand the pathways of what works, what doesn't work, where the blind alleys are, where the mistakes are, but also where the success pathways are. And that's put us in a position today to surge forward. And that's why Hoag Hospital was able to make a commitment to bringing VR and AR technology based on the hard work of many scientists who've dedicated their lives to exploring the power of this technology. Next slide. We have a library of research publications focusing on the power of the technology, ranging from addictions to stroke, to autism, to Asperger's, to cognitive aging, to post-traumatic stress. There's a long list. And again, we have this research foundation. Now we do need to extend this with today's technology and with larger sample sizes, but we have the foundation that we need to move forward. Next slide, please. Now, I was hopeful that VR technology could be used to help address some of the problems that the world was facing. And after the devastating earthquake in Sichuan, where more than 50,000 school children, mostly because their buildings had been built with inferior materials, experienced the trauma from a major earthquake. So I journeyed over to China to see if we could use VR to help with the post-traumatic stress there. And it was very frustrating for me to realize that we could not scale. The technology was not affordable and portable enough to be able to reach a large group of people who've had trauma. However, next slide, please. 3 years ago, after the Mexico City earthquake, a group of people were able to go in the very next day from the company Happiness and bring in VR systems to help on the spot teach people meditation, mindfulness, relaxation skills, stress management skills the day after this very traumatic earthquake. Next slide, please. And earlier this year, during the meeting of medical virtual reality for IVRA, there was an earthquake in Nashville. I'm sorry, a tornado in Nashville. And immediately, some of the people there were able to spring into action. Sarah Hill from Helium, Sarah Tico, Aaron Ghani from Applied VR. we were able to take the VR headsets that we had at our conference on medical VR and go out to the Red Cross shelters and help with people who had been visited by this tornado on the spot. So what's the point here? The point is the technology is ready for deployment now in a variety of circumstances, including emergency response and disaster mitigation. Next slide, please. Okay, so let me give some specific examples of how we're using VR currently. Next slide. The whole spectrum of medical training is changing. We now can use simulations as part of surgical skill training, interpersonal skill training, how to use specific medical devices and tools, how to practice as a team, again, preparing for unusual events that you still need to be prepared for, even though they're hard to rehearse for. And we can rehearse till we have things down to the most efficient way to do things. Next slide, please. What I'm excited about is it's not just one person learning something, but the teams can practice together, and they can be distributed teams. You can have an expert in another location, look over his shoulders and show you a procedure through the power of VR simulation. Next slide, please. We're entering into an era of electronic cadavers, which allow us to look more closely at the anatomy and physiology and examine the microscopic features of organs and tissues, but also see things in a more realistic, dynamic manner where we can overlay physiology on top of anatomy and be able to, through simulations, dynamically change features to see what the consequences are. Next slide, please. We also have virtual patients where we can, where a learning clinician can practice their interpersonal skills and understand how to diagnose and how to deal with a difficult situation or perhaps a difficult patient. Next slide, please. And of course, it's critically important that we as clinicians learn how to deliver bad news, but it's the sort of thing you don't want to learn on the job, and it's expensive to use actors and actresses to teach those skills. So with simulations, we can prepare people to have the skills they need to deliver uncomfortable news. Next slide, please. Moving on to the field of objective assessments, where there's a lot of breakthroughs recently. Next slide. Probably many people who are watching this presentation have seen this demonstration. It's all too common where to show the power of VR technology, people will put you in a virtual elevator, take you up to a top of a rooftop, have you look down below and maybe suggest that you step off. And the reason that people use this demo is that it shows that even though you're in a room and your friends are there and you're talking to other people, your brain believes you're someplace else. So this is the power of VR to take you someplace else and create a cognitive state. In this case, fear of falling, maybe terror of falling. Next slide, please. And why do that? Why do we emphasize the power of VR to take you someplace else? What opens up a whole field of more objective diagnostic assessments. Next slide, please. We can now do more standardized cognitive assessments with challenges to the individual, both using visual and auditory, taking them someplace else. And if we can evoke a cognitive state on a command, we can measure the response to that cognitive state at the primary care level. And we can also teach people the skills of how to manage their emotional states. It's a very powerful tool to be able to assess how, instead of asking people, how are you doing and how did you feel yesterday, to be able to measure and challenge their system and see how they react. Next slide, please. I'm also excited by the work of combination, where we may have people do a memory task, but we also study their movements as they go about it, come up with a much more accurate way of assessing cognitive function by combining a memory process with a movement trajectory analytics and using machine learning to parse about the different scores. Next slide, please. I'm excited that one of the VR companies has just released a new headset, the HP Omnicept, that combines a VR, high-end VR system, but also with biosensors so that we can measure pupillometry and heart rate variability and capture facial expressions and use the back-end analytics to interpret those and come up with a score using machine learning to come up with a measurement of cognitive flow. Just one example of how VR and AR technology will come up with a whole new capacity for cognitive and emotional state assessment. Next slide, please. I'm excited by the work of Dr. Lee Williams, where her research group is coming up with precision medicine targeted interventions for anxiety and depression. But she's using VR, AR, wearable sensor technology, and classification systems to do this. Next slide, please. In her lab, there's new approaches to cognitive assessment where we use neuroimaging to explore cognitive control and the default mode and negative affect, positive affect. We evoke these states using virtual environments. Next slide. This ideally allows us to come up with a diagnostic pathway to properly match an individual to the right treatment plan. Next slide, please. By correlating brain circuit biotypes with virtual environments and the response, it allows us to come up with tools that can be used in primary care to be able to do a more precision analytic to identify different biotypes to help refine the intervention choices that we provide to individuals for depression, for example. Again, being able to use VR as a diagnostic tool at primary care to understand the right biotype diagnostic pathway, a very powerful thing to do. Next slide, please. And to that end, some research groups, including my research group at Stanford, is working to come up with a public database of evocative VR environments that can be used to facilitate research and clinical care. Next slide, please. Okay, in the field of improved interventions, next slide. I'll give you some examples of how we are clinically using VR and AR today. And of course, we'll hear more examples from our speakers. Next slide. Dr. Lewis will talk about how VR and AR can be used for preoperative planning and image-guided surgery. Next slide, please. I'm excited by the work of Penumbra, who have recently released their new stroke rehabilitation system. It's going to make a profound difference in stroke and traumatic brain injury recovery. Next slide, please. I'm also very excited by the fact that we now have some new tools for mental health care, and we'll hear more about that today. Our mental health care system has had logjam and has been very difficult. People make the hard decision to seek help. They make a phone call trying to schedule an appointment at a clinic and to deal with their suicidality or their problems with addiction. And they're told there's a 3 or 4 month waiting list. The tools that we're evolving today for VR for mental health care will help us address this backup. Next slide, please. We'll hear a lot today about VR for pain distraction, both acute and chronic. That's so exciting and so important. Next slide, please. Another profound area is how we can use VR for exposure therapy to help with post-traumatic stress, phobias, anxiety disorders, and also to help with addictions and related disorders. Next slide, please. We can use simulated party scenes or a bar or a liquor store to teach people refusal skills and situational confidence so they can manage their cravings and practice saying no to pressure from peers. Next slide, please. The virtual environments are used to create a whole raft of mental and behavioral health problems, phobias, obsessive compulsive disorders, anger management, psychosis, eating disorders. Next slide, please. Social anxiety disorder, depression, mild cognitive impairment, autism, and attention deficit disorder. There's a very long list. Next slide, please. And virtual hospital tours can be used using 360 video to relieve preoperative anxiety. We can have people get familiar with what their experience will be like at the hospital a week or a month in advance to help reduce that anticipatory anxiety. Next slide, please. And in senior care, we have a number of new tools to help address senior isolation and also to address some of the healthcare conditions that our seniors have. Next slide, please. And of course, end-of-life care and hospice care, VR can make a profound difference. Help people to go to places that they have never had a chance to go to before, have experiences they've always wanted to have, and connect with spiritual issues and address end-of-life issues. Next slide, please. I'm excited to see that there's evolution of platforms, and we'll hear more about that today from Behavior, that address not just one particular clinical indication, but a platform that will address a spectrum of clinical indications. I think this makes a lot of sense. Next slide, please. And again, a lot of the tools we're evolving with VR in healthcare give us the ability to promote health and wellness and promote stress management, address disabilities by using VR as a disability interface, address isolation, and promote adherence to exercise and weight management programs. Next slide, please. I'm excited about the potential of having a dialogue with your future self. I think this is a very powerful tool that's underutilized and that we can start building into some of our products. Seeing the effects of our behavior and how it will affect our future health is a key thing that we don't have very many techniques to use right now. Next slide, please. And of course, VR and AR technology allows us to have a telemedicine platform, which is very exciting, allows us to, well, with the pandemic, it becomes critically important, but also allows us to reach previously underserved populations. Next slide. Okay, let's wrap up. I've talked a little bit about where we were with VR technology, where we are now. Let me speculate a few about some of the trends that are on the way. Next slide. In the near future, we have so many evolutions of the technology. Every year we will see improved capacity. And again, I think with the introduction of 5G, it's just going to allow us to have a surge forward. We can look forward to more wireless connectivity, allowing us to use very light duty headsets that can provide an augmented reality experience without being too intrusive. We'll have better ways of interacting with voice commands and gestures. And I think mixed reality will start becoming more common, where we're going to mix extra information, VR information, with the realistic environment in a very well-designed method. Next slide, please. I think we'll start using the concept of the future self and also of digital twins to allow people at their home to have a sense of their own health status and what they can do to improve it. Closing the feedback loop, I think, will make a big difference. Next slide. I also think we're going to start getting information, leveraging all the sensors and challenging VR challenges that provoke data about cognitive status, emotional status, to allow clinicians to manage a patient between visits. This is just an evolution of our ability to capture information in a dynamic way and will allow us to do a tighter preventative medicine and also follow up post-discharge. Next slide. At Children's Hospital of LA, the residency program, the hospital uses VR as part of the required curriculum for interns. And the interns are required to have training using VR before they're allowed to work in the emergency department. I think we'll start seeing this training paradigm of simulations being more and more common and more required before you're allowed to be in a critical position. Next slide, please. I think we'll start seeing VR and AR systems as part of combination therapy and not used just on their own, but part of a whole plethora of interventions. Next slide, please. And again, as we aggregate data in the cloud, we'll start putting it together and with machine learning, be able to understand the most appropriate pathways. Some of the protocols that we've been using for decades have been based on analog information from small sample sets. We'll soon be able to address that with more robust information from larger groups of people, be able to come up with age-appropriate, culturally appropriate, physiologically appropriate interventions, less of a one-size-fits-all and more of a custom precision medicine approach. Next slide, please. So right now, there's a few areas of VR and AR where there's considerable activity. Next slide. There's a few areas, though, that are relatively under-addressed. So this presents significant opportunities for us, both as clinicians, as research scientists, and as product developers. Next slide, please. And for me, it addresses the thing that I worry about beyond the current pandemic. Next slide, please. I'm excited because everything that we've talked about in terms of VR and AR technology will have direct ramifications for improving senior care. We'll have improved assessments and diagnostics. We'll be able to use VR to reduce isolation, loneliness, address acute and chronic pain, depression, anxiety, stroke and physical rehabilitation, disability interfaces, post-discharge follow-up, and staff training, not just for procedures, but also to have empathy for our seniors. I'm so excited about the potential of the technology to address that strata of care. Next slide, please. Okay, in summary. Next slide, please. The current technologies that we're using are founded on more than 30 years of research and development. They're not just evolving in the last few years, and there's a foundation of validated studies to show us the pathway. Recent changes have made VR very, very affordable. We can get a great system for less than a third of the cost of a smartphone. We're using VR and AR systems for the whole stack of healthcare, prevention, evaluation, treatment, and chronic disease management. I feel that Hoag, as a leading center of excellence, moving forward with this technology is making a huge difference. And I think we're poised to have it move beyond just one or two centers of excellence. I think with their leadership, with Hoag's leadership, we'll be able to move out into the mainstream. Well, that's the end of my presentation. Thank you very much. Oh, I should mention, I talked earlier about the fact that we've had some stalwart people who've worked very hard on their careers to move VR and AR forward. Well, now it's an even larger number. It's growing, and it's so wonderful to have colleagues helping us move this all forward. And Rob, thank you, and thank you, Hoag, for being a leader in this zone. Thank you very much.